One of the things that Accreditation does that I think is probably one of the most difficult for us, but it's been the most helpful really in a lot of ways, is the QA meetings. The thing that we found that was so interesting is it opened dialogue across with the physicians and the sonographers about what we wanted to see and exactly where we needed to be with something. If we're going to incorporate a new technology, how are we going to do it? When are the docs going to start interpreting it? How is, what's going to be the playing field for the interpretation? What's our report going to look like so it's all consistent? Also, I would have to say, as we've gone along over the years, the process has gotten a lot easier. So, last accreditation I did was online, and that was wonderful. I do want to say that I think the IAC has great staff. I cannot tell you how many times I have called them, and they've always gotten an answer for me. And I know a lot of times when we call, it's last minute. It's, like 4:30 on the day that we have to send it out the next morning. But they always get right back to us with an answer. We're in a very competitive market in Richmond because there are a lot of hospitals and there are other places in the community even that they can go. But I think they tend to gravitate, especially the patients that do the research. If they go on the website, even if their pediatrician or their cardiologist doesn't tell them that we're accredited, I think a lot of them are going and looking on websites to get more information about, who's the best place to go for their children. Most of the pediatricians that I've had contact with probably put more emphasis on being accredited as far as just sending it to someone out in the community.